Hey there VCE HHD students, my name is Andy, I'm a Health and Human Development teacher. In this short video we're going to look at answering the 2021 VCE HHD Exam question number 5. Before we dive into question number 5, just a reminder over at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too to access all of those videos. You can also see our social media links there if you'd like to follow us and get alerts of new videos coming out each day, as well as HHD exam tips, and also our email if you've got any questions or suggestions, videos you'd like me to work on. Now you can see here the 2021 exam question 5 was with 8 marks, and it started with this graph here looking at the leading causes of death globally, and you can see there was a key that provided examples of non-communicable and communicable diseases represented in the graph. And so remembering that communicable are diseases that can be transmitted from individual to individual, whereas non-communicable can't. And so the dark bars were examples of communicable diseases. So then it was representing on the x-axis there the number of deaths in millions, and the y-axis the different conditions for the years 2000 and 2019. So A for 2 marks was asking you to describe old public health. So you had to have 2 points here. So something along the lines of this referred to a public health approach prior to the 1950s that focused on the physical environment and conditions that were mostly communicable or infectious diseases. Would have gotten you most likely 2 marks. You could have also mentioned that some examples of old public health, such as improved access to things like clean water and sanitation. So then B for 2 marks was asking you to select one of the leading causes of death from the graph on page 6 and describe how actions undertaken as part of old public health could be used to reduce global deaths. And so because I mentioned previously that old public health kind of focused mainly on infectious diseases, then it was best probably to choose an example from the graph that was a communicable disease, so it could be transmitted from one individual to another, because then you could have given some examples that were part of old public health to link that to reducing global deaths. And you'll see here in the examiner's report that's what they did. The high scoring response chose diarrheal disease, and then they said that global deaths could be reduced by enabling access to sanitation and waste removal. And they said that by removing human urine and feces and containing it, the risk of contaminating drinking water or food supplies with pathogens was significantly reduced, and that reduces the risk of transmitting and contracting diarrheal disease, which might protect vulnerable individuals with weakened immune function and therefore reduce global deaths. So you can see there that I mentioned in the examiner's report also that students should refer to their cause of death exactly as it was referred to on the graph, so there was no misunderstanding regarding what leading cause of death you were choosing. C was then asking you to select another leading cause of death from the graph on page 6 and explain how the biomedical and social models of health could be used to reduce global deaths from this leading cause of death. So it says another, so that means you couldn't do the same example as you had for B. And remembering that biomedical has got to do with cure, treatment and diagnosis of disease, including things like health professionals and medical technology, whereas the social model is more focused on preventative action by changing behavior of individuals, by altering things like the physical environment or social and political environment, and involves things like health promotion and health campaigns. So for whatever example you chose, you just had to link into some of those aspects of those models. So you can see here the high scoring response where they focused on trachea, bronchus, lung cancers. In relation to the biomedical model, they talked about lung cancers might involve tumours, and due to the biomedical model of health, people are able to undergo surgery. So they gave a specific example related to sort of the treatment and cure. By being able to remove tumours, less people are dying from cancers, and that can reduce overall global deaths. Whereas in relation to a social model, they talked about campaigns and laws such as Quit Smoking campaign, allowing for people to educate others about the harms of smoking. Warnings such as ones on boxes with cigarettes could show the impact of it, and if less people smoke, less people might die of lung cancer and reduce global deaths. So it's a good question to go back and practice to think about how those two models can work together to address health conditions. As you can see, only 21% of the state was able to achieve full marks. Okay, hopefully you found that video useful. A reminder, the Health Resources Hub YouTube channel, our social media links, and our email. Thanks so much.